The charge nurse is making client assignments in the cardiac critical care unit. Which client should be assigned to the most experienced nurse? This is a keyword. The reason this is a keyword because the answer to select when the question says the most experienced nurse is very different if the question stated which client will you assign to the least experienced nurse. The answer will be totally different in both scenarios. In this question, you can use a strategy. It's called the SAR method. The SAR method will help you identify which patient is the most critical patient. Number 1 says the client with an acute rheumatic fever. The word acute is important because using the SAR method, you need to identify if the patient have an acute or chronic condition and who is more unstable. A client that has an acute condition, something that is going on right now, or a client that was diagnosed several months ago with a chronic condition. Usually acute conditions take more priority than chronic conditions. So number 1 is an acute rheumatic fever carditis, but listen to the problem. The problem comes after the fact. It says, who does not want to stay on bed rest? So his problem is that he needs to stay on bed rest and he decides not to. So this patient needs teaching. Teaching has to do with the learning process. And the learning process is psychosocial in nature. So we will say that this patient has an acute condition and that he needs teaching, which is a psychosocial need. Another thing that I do, I compare one answer with the next answer. And I pick in between. Who needs more help? Who requires the most experienced nurse? Let's look at answer number 2. The client who had the following arterial blood gas, pH 7.35 is normal, PaO2 is normal, CO2 is normal, and bicarbonate, HCO3, is normal. So if we compare 1 and 2, 1 needs teaching. So 1 has more priority than answer number 2. So we eliminate answer number 2. This is the process of elimination. Answer number 3. The client who is tells me that this is an actual problem. This is an acute condition as well. So 1 and 3 are both acute. But what is he showing? What is his acute condition? He's showing keyword multifocal premature ventricular contractions. The word multifocal is a keyword. Why? If the patient is having sporadic PVCs, it's not as important. PVCs usually is benign. But when you're having PVCs from multiple focus, that means that there are multiple ectopic cells in the ventricles creating this stimulus, this electrical stimuli. And the problem with multifocal PVCs, it is a predisposing factor to ventricular tachycardia and ventricular fibrillation. So this is an emergency. It's an acute condition where the patient is unstable and the patient has a physiological problem that has to do with ABC, because the heart is the pump of the circulatory system. So when we compare 1 and 3, 1 only needs teaching with a psychosocial need, and 3 is an acute unstable condition where the patient has a physiological need involving ABC. And if you remember Maslow's hierarchy of needs, Maslow says that physiological needs have priorities over psychosocial needs. So we eliminate answer number 1, and for now, 3 looks like the correct answer. Let's look at answer number 4. The client is diagnosed with angina. What is his problem right now? Because angina is a medical diagnosis. I need to know what is going on with my patient. It says diagnosed in the past. How long? I don't know. What is the problem now? There's no problems. The only thing that we know is that he is scheduled in the future for a cardiac catheterization. So if you compare 3 and 4, 3 has an actual problem right now experiencing at this moment. And it's showing cardiovascular compromise. When we compare 3 and 4, 3 has the highest priority. A cardiac cath is a routine procedure. It's a diagnostic procedure where doctors can identify certain things. The correct answer is answer number 3. Now I want you to notice that I followed a process of critical thinking. I was not just looking at the content involved in this question. And that is why I tell you that it takes a little bit more than just content to answer these style of questions.